Thank you for inviting me here today, and I'd like to acknowledge the traditional owners of the land, both past and present. I'm Lee Watts, the independent candidate for the seat of Upper Hunter, and let me be absolutely clear. I fully support the calls of our nurses for equal staff ratios to the city. I'm sick of the people of the Upper Hunter being treated like second-class citizens, and the major parties justifying it. Why should our children, our friends and our families have less nursing care than if we lived in Sydney? I don't believe NSW stands for Newcastle, Sydney and Wollongong, but that's where our taxpayer dollars and our mining royalties go. To form a position on nursing ratios, I didn't seek the advice of bureaucrats in Sydney or a political party spin doctor. I spoke to the nurses who care for us and asked them what it is they needed to do their job well. We need the same nursing levels as the city, a ratio of 1 nurse to 3 patients in emergency and 1 nurse to 4 patients on the wards. But here they get 1 to 5 if they are lucky. When a nurse looks after more than 4 patients, there is a 7% greater chance of a patient dying. Now think seriously about if you want your child, friend, family having those odds. And if the nurse is looking after 6 patients, the risk of that death doubles. This is because the nurse physically can't observe each patient as closely and things get missed. The government say we have less nursing care because in the city the patients are sicker. But in larger hospital, nurses have a cannula team to put in a cannula, a team which makes beds, in fact a raft of teams, with doctors, specialists at the ready. In regional areas we have no special teams, you need to do it all and you have no doctor within the hospital. They have to be called in. So we deserve more, not less nurses. The new ED is double the size and double the beds, which is wonderful, but is double the staff? Of course not. Our nursing staff are regularly doing double shifts because not enough nurses are employed in the hospital. Do you think that this is the best interest and best interest for the patients? A few things the nurses have told me which they don't feel they can say themselves include: tell them the government does not have their health care at heart. Tell them they don't want to spend their tax dollars on your health, they'll be spending it in the city. The nurses are especially angered by Michael Johnson's speech. To be read here today, I wanted to let him have it, so I'll do it on their behalf. Most of the comments can't be read publicly, but here are a couple. His remarks are completely ignorant. I know healthcare is not his whole campaign, but nursing is my whole life, and he has no idea that what he is suggesting is harmful for the patients I care for. Saying we should decide locally is not fair because when we go to get the resources, we are told the buck passes staff. But I believe our nurses do know what they are talking about and deserve our support. Today there is the opening of the new ED, emergency department, and staff have been told not to talk about the rest of the hospital. So let me be clear about something else. I support a new hospital for Muswellbrook, not a series of band-aids on an old hospital. Parkes had a hospital built on a slope and they were given $72.5 million for a new one. So why can't Muswellbrook have a new hospital? We need 80 million and the department does not have to come up with that money. It can come from resource for regions. This area generates billions. Why can't we get a new hospital? Instead we get band-aids for an old hospital and told how great those band-aids are. 9.4 million was supposed to be spent on the new emergency. We got 6.5 million. They promised 44.6 million for stage 2, but we only have 20 million. So the band-aids are being stretched. The old hospital is full of asbestos and to remove it will cost at least $4 million. That's money that could go on new equipment. It's like building a new house on a flat block or trying to renovate an old house full of asbestos on a slope block. What will you get more value of money from? When I've talked to staff about the new ED and if it is still worth moving to a new purpose-built hospital, the answer has been a very clear yes. I've also been contacted by many patients about the conditions in the old hospital. Not even the air conditioning work, and it's unacceptable that the people who are sick and dying are sweltering in our hospitals. But at least the new ED has new air conditioning, right? Well, yes, but it won't be working properly for the next 6 months. Because while they were trying to put new things over an old hospital, a vital part of the air conditioning was damaged, and that part will now have to go to France to be repaired. They're trying to put lipstick on a pig and it just does not work. We are not asking for more than anyone else. We are simply asking that the lives of our family and friends here are just as important as the life of someone in the city. So why aren't we being treated the same? We have a safe national seat for more than 100 years. When you're considered a safe seat, you don't get proper funding from either party. I'm not going to let the Labor Party off the hook either, so let's remember, under a state Labor government, our services have been run down and cut back too. So what can I do as an independent? I will work with whichever government is in power. I am not anti-national or anti-Labor. I am pro-Upper Hunter. So I will put your interests first and work with both parties to your advantage. How do you think Tamworth got a new hospital? They had an independent. So if you want a new hospital, a voice for our nurses, not a political party, more of our tax money and mining royalties to come back to us, and that a child growing up here has the same nursing care as a child growing up in the city, then you know what to do on election day. You know where I stand on these issues, and what you see is what you get.